This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
And we are back, baby, for the Berman Method podcast. Was that lovely?
Yes. I think that was one of your better ones yet.
Hitting the high pitches?
I like it.
Or is that the low pitch?
You've been practicing.
I think that's a low high pitch. A higher of a low pitch?
IDK.
Here we are, Dr. Jake Berman here with my lovely co-host,
Jenny Berman, physician assistant.
Good morning, good afternoon, good evening, whenever you're listening to this. Hopefully it's first thing Monday morning. We are focused on treating problems and not symptoms. David against Goliath, going against the corporate medical system. We do not believe that the corporate medical system or Big Pharma has your best interests in mind. They are focused on client retention and not curation, and it's been proven time and time again. And we just ain't about that.
That's right.
Right?
Focused on treating problems and not symptoms.
Yes. Insurance companies are no different from any other business. Well, I shouldn't say it that way. Insurance companies are very similar to a lot of very big businesses where they are focused on profits versus patient outcomes. Right? It's very simple. If you're not profitable, then it doesn't really matter about anything else. So anybody that has ever struggled with getting something reimbursed, you understand that, or at least you should understand, that the insurance company's job is to deny. It doesn't matter how legitimate it is, they will deny.
Right. We've been through that many times.
Holy guacamole. Let's go way back. Let's go back to the early years when I first opened up. One of the first clients that I had back in the day, she actually worked for one of the major healthcare insurance carriers in the country for 20 years. And she actually just retired within a year. And she agreed to come to see me completely out of network for some physical therapy services. And she knew that she could take my receipts and submit them for out of network reimbursement. And she knew every single code and number and identifier that needed to be on that receipt because she had literally just got done doing this for 20 years.
Right.
So she actually educated me when I first opened up. Actually, you need to format it this way. You need to highlight this line to draw attention to it this way. And she was just giving me all of these tips where she's like, these are the reasons why they will deny. And I was like, wow, this is amazing. Thank you so much.
Right.
So after she was done with her plan of care, we created this itemized bill for her to submit that was exactly word for word, cosmetically appealing. Everything looked the way that it was supposed to look.
And she still got denied?
She still got denied.
Stop it. I didn't even know about this story. But I always wondered why our invoices have like certain highlights on them and certain bolds, but I never changed it. I just went along with it. Now I know. But I didn't know she still got denied.
She got denied. So she called him up and argued with him. And she literally said the words, listen, I know what you're doing. I worked there for 20 years. I just retired. You're not going to deny this because this is everything that you need. And they said, well, no, the period is in the wrong place. Can you please resubmit or some bullshit answer?
Oh my goodness.
Long story short, she went back and forth 4 different times on the phone, 4 different invoices that I created for her before they finally agreed to pay her the amount that she was due to get back. Because the first time they said, no, we're not paying anything. Then the next time after a 30-minute long conversation, they said, okay, we'll pay you $15 for every visit. And she said, absolutely not. So then the third time they said, okay, we'll pay X amount. And then finally, after the fourth time, they agreed to pay her back whatever it was that she was supposed to be paid, because that's what her plan signed up for, or what she was paying for. So now when people want to come see me and submit for out-of-network reimbursement, I say, you're more than welcome to do it if you want to see how high your blood pressure can get.
Right. How many times do you have to fight with them and how angry they make you before they finally agree to do something?
Yes. How many times have we dealt with this over the past 4 years, going from being two young, healthy adults, never going to doctors or hospitals, to having a kid, having a second kid with all sorts of things that were supposed to be covered and weren't covered. And
yeah. I mean, we've talked about it before on this podcast that we lost a baby at 16 weeks and had to have a D&E. They had to go in and actually deliver the baby, and insurance came back and said they were not going to cover the procedure of delivering this 16-week-old dead fetus because it wasn't medically necessary to deliver the baby. And so they just weren't going to cover anything. And we had to fight and fight and fight and say, this was a life or death situation for mom. I mean, baby was already gone, but life or death situation for mom, and it wasn't going to be covered because it wasn't medically necessary.
And this is no exaggeration. That's not sugar-coated. That's as explicit and as blunt as you can get. This was a surgical procedure that had to be done, and it was not cheap at all. Like, it was a surgery.
Right.
Right? Under anesthesia and everything.
Right.
And they come back and said, this was not medically necessary. We're not paying for anything. And we are ripping our hair out trying to talk to people over the phone, because you can't talk to anybody in person.
No.
Like, you can never go face to face with these people and try to reason with somebody and rationalize. This is always over the phone. Like, do you understand there was a dead baby in my body that wasn't going to pass naturally?
Right.
So what do you mean this wasn't medically necessary?
Right. So not only now did we just lose our first child, but then we're arguing with the insurance company about wanting to cover something. So it's just, I mean, it gets to the extremes. Like, yes, getting reimbursement for physical therapy is really important to a lot of people, and you can fight and fight and fight and maybe get reimbursed for it, but it goes to the extremes of something like our situation. It's crazy.
I don't know if I would use the word extreme. I would use the word clear.
Sure.
Right?
Okay.
So our situation was clear, cut and dry, black and white. You should pay for this.
Right.
Then you can go down this rabbit hole and try to say, maybe it's not clear that they should pay for X, Y, Z, and that's why you have to argue. But it's really not. At the end of the day, their job is to deny, because they are about profits, not patient outcomes. The more money they have to pay for your medical services, the less profit they make. It's that simple.
Right. And that's the same thing that we've talked about a few times on this podcast on why our practices are out of network, specifically my health and wellness and your physical therapy practices not accepting insurance. And it's because as a provider, we cannot do what is medically necessary for our patients because we are being dictated by what insurance says they will pay us to be able to do.
What they deem as medically necessary.
Right. So the insurance company is deciding what the doctor or the PA or the doctor of physical therapy should actually be doing for treatment, even though they haven't even seen the patient or not once or spoke to the patient or understood what's going on with the patient. But they want to tell us what they will consider necessary for treatment.
Right.
Or for diagnostic testing, in my case.
I'm so glad you said diagnostic testing, because that's actually what I wanted to talk about in the first place today before I got off on this rant.
We're always on rants.
So over the weekend, I was talking to a guy down on the beach where he's the father of a dear friend. And we were just talking about, he found out I was a physical therapist, and he's like, yeah, my knee popped and I just finished physical therapy and now I'm waiting to get an MRI. And I said, okay, tell me more. I was like, how's your knee feel now? He goes, oh, my knee feels great now. I said, okay, why do you want an MRI? He goes, well, I just want to know. I mean, I don't know if it was my ACL or I just don't know what it was. And I always try to tread lightly when I'm talking to people that don't really know me or what I stand for and how aggressively I stand for it, or bluntly, or whatever you want to call it. I said, okay, so you just want to get the, even though your knee's feeling great now, after you just finished physical therapy, you just want to get the MRI. He's like, yeah, I mean, I just felt a pop and I just want to make sure that it wasn't my ACL. And I just, I didn't really push it, and we went on to something else. But I wanted to talk about it today because it's so common that people want to get an MRI.
Right.
I felt a pop. I felt a click. I heard a pop. I heard a click.
Mm-hmm.
I want to get an MRI to make sure that nothing broke.
Right.
And it's so funny that I wanted to talk about this today because on my time hop, this thing just popped up on my time hop. That those of you that don't know what time hop is, it's an app on your phone that brings up pictures from the past that were whatever happened on this day a year ago or 5 years ago or 7 years ago, whatever it was back in time on today. And today what popped up was 8 years ago, I took a screenshot of this thing that I saw on the physical therapy, APTA, American Physical Therapy Association website, that says patients who get imaging before physical therapy spend $4,793 more than those who get physical therapy first.
And you showed that to me this morning. You're like, oh, coincidentally, what we're going to already talk about on the podcast today. And he showed that to me, and I was like, and that was 8 years ago. Now it's probably triple that amount.
It has to be triple that because this was 8 years ago and people were spending $5,000 more. If you got an MRI before you got physical therapy, on average, you were spending $5,000 more than people who got physical therapy first. And this was 8 years ago. It has to be at least 10 grand, probably 15 grand.
Yeah. Yeah. We just went through a very similar situation to this with one of our clients who came to see us and committed to doing a program with us for her GI issues. And she said, I thought about doing functional medicine 3 years ago, but decided that I would go the route of getting the testing and seeing the doctors in the gastroenterology office first.
In network.
She has now gone through 3 different gastroenterologists, had multiple scans done, 2 of which CT scans that she had to pay out of pocket for because insurance wouldn't cover it. We didn't get into the details of it, but she had already had multiple tests done, endoscopy, colonoscopy, and then ended up having 2 scans that she had to pay out of pocket for. And she's like, I should have just done functional medicine 3 years ago. I've now spent tripled what I would have spent with a functional medicine provider 3 years ago, going through all of this testing and seeing all these GI doctors, and I'm not better. Nothing has changed. I'm not better. I'm actually probably a little worse than I was 3 years ago.
And you're just talking about monetarily. So she
Correct.
spent 3 times more monetarily over 3 years. What is your time worth?
Right. And her quality of life just dealing with what she's been dealing with for that long.
What is your time worth? I mean, I get this so often, especially with my demographic. I primarily work with people over the age of 60. A lot of them are over the age of 70. And to be as morbid as possible, if you're 70 years old, you really, on average, if you want to go on average, how many more years do you have left?
15.
Right? That's an average. This is morbid. This is very morbid. But if you're 70 years old, on average, you've got 15 more years of life left.
Maybe actually, if we're talking about average, like United States average, probably less than that. What is the average death age?
I don't know. Let's just say 10.
Okay.
Okay. So if you're 70, let's say on average, you're going to live till you're 80. You've got 10 years. And you're going to sit here and tell me that you're going to wait to go through the cookie cutters R Us physical therapy so that your insurance will pay for your MRI just so you can be in line
Right.
to get surgery?
Right.
And I'm going, we're talking about 6 months minimum. Then by the time it's all said and done, you do have surgery. We're talking about 18 months.
Right. Right.
We're talking about over 10% of your life that you have left. You just wasted on waiting for an MRI and surgery.
And you might not even be better after the surgery.
You might not be.
Seeing a patient. So I just checked. Oh, this is actually from 2020. The average death age was 77.
Jeez,
That was in
Louise.
2020. So if you're
Okay.
70, you have 7 years left potentially.
On average. And, we all want to sit here and say, yeah, I live a very healthy lifestyle. I'm very healthy. I'm not average. I'm way healthier than the average person. However, you don't know when it's your time. It just popped up on the local news this morning that 2 71-year-olds died in a boating accident just up the road from us.
Yeah.
Like, you don't know. I mean, these 2 71-year-olds could have been the healthiest people on the planet, husband and wife. And they came around a corner, lost control. They ended up in the woods and they're both dead.
Mm-hmm.
So you don't know that you're going to make it till 80. Why in the world would you want to wait 18 months for an MRI and possibly surgery?
Right. Right.
So anyways, I want to come back to this statement where it says people who get imaging first spend on average $5,000 more than people who get physical therapy first. The reason why that is what Jenny just insinuated, or not insinuated, outlined with her wellness patient, which is you go down this rabbit hole of what insurance deems as medically necessary. And it's these tests and measures that may or may not be appropriate or relevant for what you're dealing with. And you're paying copays, you're paying deductibles, you're paying all of these things that you don't expect to pay along the way. And the next thing you know, it all adds up because we're talking about over time. Everybody thinks that it's Amazon Prime, like it's going to be here tomorrow. I'm going to get an MRI and I'm going to have results the next day and the solution's going to be there the next day. It's not.
Right. Right.
It's absolutely not.
And especially outside of physical therapy in our world, if you're going through a CT scan, then the radiologist has to read it. And then you go to a colonoscopy and endoscopy and they got to send for biopsies. And then you're waiting on blood tests to come back. Like this is a whole process.
So let's start to get ready to land the plane here and bring all of these things full circle. In the first job I ever worked at as a physical therapist, I was up in the panhandle of Destin, and I actually had a patient who was an orthopedic surgeon, and I'll never forget the words that he told me. We were talking about MRIs for some reason, and this guy was very conservative. He was not scalpel happy by any means at all. And he goes, I tell everybody that comes in my office asking me for an MRI, I say, why do you want an MRI? Do you want to have surgery? And 100% of the people say no. It's like, okay, you don't want to have surgery, but you want an MRI. And this surgeon came up with this kind of sarcastic, caustic comment and said, what MRI stands for? Might require incision. And the patients would always look at him baffled and say, what? He goes, you should not get an MRI unless you are prepared to have surgery. Because once you get an MRI, you now have a diagnosis.
Mm-hmm.
Before you have an MRI, you don't have a diagnosis. You can use knee pain, for example. Knees are probably one of the easiest ones because they naturally degenerate over time. They just do.
Mm-hmm.
So if you're 60 years old and your knee hurts, you don't know why it hurts. You just know that it hurts. I know why it hurts because 9 out of 10 times knee pain is caused by weak ass syndrome. However, you don't know why it hurts. So if you skip coming to see me and you go straight to the orthopedic surgeon who orders an MRI for you, then your MRI is going to come back and it's going to say that you've got degeneration of your medial compartment. Your lateral meniscus is torn 3/4 of the way. And it's just going to say all of these things that are a normal part of the aging process. But before you had that MRI, you didn't have that diagnosis. After you have the MRI, now you have a diagnosis of medial compartment degeneration and lateral meniscus tear. So now every time your knee hurts, your brain fixates on your diagnosis.
Right.
You're like, oh, can't go up that stair because my meniscus. Oh, can't go up that stair because my bone on bone. I'm not going to get down on the ground and play with my grandkids because I've got bone on bone. Versus if you come and see me and you don't know what it looks like in there, I'm going to say, oh, the reason why your knee hurts is because it's not getting enough support from your ass.
Mm-hmm.
Let's work on your ass, get your butt stronger. And now all of a sudden your knee has the support that it needs, so the inflammation decreases and the pain response resolves. Now you can go up and down stairs without thinking about it. Now you can get down on the ground and play with your grandkids without thinking about it. Because you don't have a diagnosis in your knee. You actually have a diagnosis of weak ass syndrome, and it's in your ass, not your knee. So when your knee hurts, you're like, oh, my glutes are not working. Let's get the glutes firing again.
Right.
Tiger Woods.
So in other words, you're saying is that the MRI is telling you that you have a diagnosis that could require or probably would require surgery, but that really may not be where your pain is coming from. So if you are able to have a different type of evaluation and treat the problem and not the symptom of where the pain is resonating, then you may not need the surgery to fix whatever the MRI is showing.
That is correct. Here's another way to say exactly what you said, and I don't know that I've ever said it this explicitly, so hopefully I get a little backlash from this, from people that are critiquing. Here's one thing that I can say. If we're talking about musculoskeletal pain, so muscle pain, joint pain, if it is non-traumatic, which means you did not have an injury, there was no trauma, there was no car accident, no slip and fall, no bicycle accident, you didn't get hit by something, there was no trauma, and your knee just started hurting for no reason one day, your shoulder just started hurting for no reason, your back just started hurting for no reason, and no, bending over to pick up a pencil and your back goes out, that's not a trauma.
Mm-hmm.
Whenever that's the case, wherever your pain is, ain't where the problem is.
Right.
I don't know a single time in my whole entire career where that has not been true. Wherever it is, it ain't. Wherever the pain is, ain't where the problem is. The pain is a symptom because of a problem somewhere else. And I have never in my entire career seen the two be at the same place for non-traumatic pain.
Right. So unless there's a specific event or injury, and this kind of goes with the neck issue that I had over the last couple of months, which was a wild presentation of pain that I had in my neck, actually I felt when it exactly happened. But it turns out that the pain was really not coming from my neck. I was feeling pain in my neck. I was having trouble swallowing to the point that was affecting my neck, but it was actually coming from lower down, from a musculoskeletal issue, right?
It was nuts.
Yeah.
Absolutely nuts. And if we were not family, I probably could have figured it out sooner, right? But this was a perfect example that you can't treat family because it's too subjective. There's too many emotions. It clouds your objective thinking. And for those reasons, I intentionally say I'm not working on you or any of my family members because we're just not going to get the results that I would expect. But yes, I mean, it was a weird presentation where I'm going, I told you explicitly, I was like, this is outside of my scope of practice. Call up Gerber, call up the surgeon, get an MRI, do something else, because it was just weird. And we chased that rabbit hole, or we went down that rabbit hole for a few weeks before finally I said, okay, nothing's getting better. Nothing's getting worse. Let's do some objective testing. How would I treat you if you were just some random patient that walked in the door? And we started doing that, and come to find out it was scapular positioning and posture that was putting all this stress on the upper cervical area, mid to upper cervical area. And it's like, geez Louise, this is so simple. Not easy, so simple.
Right. So the point of that story was it was really coming from my scapula. Underneath the scapula, the way my shoulder blade is what the scapula is, was positioned. That was the entire problem. But the symptom was at my neck and presenting very strangely. I mean, it was affecting my ability to eat and to swallow and causing pain actually at the cervical spine.
Yeah.
But it wasn't my spine.
Yeah. And this is a perfect example where I'm not Superman, I'm not God, I can't fix everything. And if something is not making sense to me, I will be the first one to refer you out. I'll be the first one to say, you got to go get an x-ray, you got to go get an MRI to make sure that I'm not missing something. And this was a perfect example with you where it was not making sense to me. So the MRI was relevant. It was necessary because as soon as your MRI came back pristine, I mean, there was nothing wrong on that MRI. I was like, okay, then this is in my wheelhouse. This is something I can figure out. It's just presenting differently than I had ever seen before. So that's when I'm like, okay, we ruled out the scary stuff. Let me get to work.
Right.
Good?
Yes, perfect. So you might go out of network and put a little skin in the game, but it's going to work out in the long run. It's going to be way more beneficial in the long run if you put a little skin in the game early.
Yeah, it's way more upfront. However, it's significantly less long term. You just have to put the money up front versus you'd go in network, you're putting way less money up front, but it's going to drag out forever and you're going to keep getting nickeled and dimed. And then next thing you know, 5 years down the road, you've quadrupled the amount of time and money that it would have cost you if you would have just did it the right way.
With potentially no improvement.
Yep. Kind of like fixing a boat, right?
Oh.
Didn't we talk about that recently?
Mm-hmm. Yeah, go back and listen to it. All right.
Good.
Like, subscribe, comment. We want some more comments.
Yeah, this is a good one to comment on, especially all of my peers out there that are listening to me. All non-traumatic pain, the problem is never there. Let me hear your thoughts on that, critics.
Ciao for now.
See ya.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.